Nursing Assistant Exam Book. Question 1. The proper body mechanics for lifting includes: Option A, lifting with the back. Option B, lifting with the legs. Option C, twisting while lifting. Option D, lifting with arms extended. The correct answer is option B, lifting with the legs. Lifting with the legs, bending at the knees, keeping back straight, uses the strongest muscles and prevents back injury. Lifting with the back is a common cause of injury. Twisting while lifting puts torque on the spine. Question 2. A client is pacing and appears anxious. The nurse aide should: Option A, ask the client to sit down. Option B, walk with the client. Option C, give the client a sedative. Option D, leave the client alone. The correct answer is option B, walk with the client. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Asking them to sit down may increase anxiety. Sedatives require an order. Leaving them alone may be unsafe. Question 3. An adult client with a respiratory rate of 8 breaths per minute is experiencing: Option A, tachypnea. Option B, bradypnea. Option C, normal breathing. Option D, hyperventilation. The correct answer is option B, bradypnea. Bradypnea is an abnormally slow respiratory rate below 12 breaths per minute in adults. 8 breaths per minute is significantly below normal. This may indicate respiratory depression, sedation, or neurological impairment and requires reporting. Question 4. A client's temperature is 101.2 degrees Fahrenheit. The nurse aide should: Option A, document the temperature. Option B, report it to the nurse immediately. Option C, give the client a cold bath. Option D, retake it in 1 hour. The correct answer is option B, report it to the nurse immediately. A temperature of 101.2 degrees Fahrenheit is a fever requiring immediate reporting to the nurse as it may indicate infection or other medical conditions. While documentation is important, reporting is the priority. CNAs cannot initiate cold baths without nursing orders. Retaking in 1 hour delays necessary intervention. Question 5. What is the first sound heard through the stethoscope when taking blood pressure? Option A, diastolic pressure. Option B, systolic pressure. Option C, pulse pressure. Option D, pulse deficit. The correct answer is option B, systolic pressure. The first Korokov sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 6. The nurse aide is performing perineal care on a female client. The aide should: Option A, wipe from front to back. Option B, wipe from back to front. Option C, wipe in circular motions. Option D, wipe in any direction. The correct answer is option A, wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 7. A client with Alzheimer's disease becomes agitated when the nurse aide enters the room. The aide should: Option A, leave and return later. Option B, approach slowly and speak in a calm, soothing voice. Option C, ask the client what is wrong. Option D, call for assistance. The correct answer is option B, approach slowly and speak in a calm, soothing voice. A calm, slow approach reduces agitation. Leaving may reinforce the behavior. Asking what is wrong may be too abstract. Calling for assistance may be needed if the client is a danger to self or others. Question 8. When a nurse aide is floating to a different unit, they should: Option A, refuse to float to an unfamiliar unit. Option B, accept the assignment but only do familiar tasks. Option C, accept the assignment and ask for orientation to the unit. Option D, accept the assignment and perform all tasks independently. The correct answer is option C, accept the assignment and ask for orientation to the unit. Floating is normal, but the aide should request orientation to the new unit. Refusing may be insubordination. Doing only familiar tasks may not meet client needs. Question 9. A client with dementia has difficulty eating. The nurse aide should: Option A, feed the client quickly to ensure adequate nutrition. Option B, allow plenty of time and provide cues to eat. Option C, puree all food to make it easier. Option D, skip meals when the client is resistant. The correct answer is option B. Allow plenty of time and provide cues to eat. Clients with dementia need extra time and cues to eat. Example, pick up your spoon. Rushing can cause choking. Pureeing may be appropriate for some but not all. Skipping meals is neglect. Question 10. What does it mean when a client is placed on droplet precautions? Option A. The client must be in a negative pressure room. Option B. The nurse aide must wear an N95 respirator. Option C. The nurse aide must wear a surgical mask within 3 feet of the client. Option D. The client cannot leave the room. The correct answer is option C. The nurse aide must wear a surgical mask within 3 feet of the client. Droplet precautions are used for infections spread by respiratory droplets. These droplets travel up to 3 feet, so a mask is required within that distance. Negative pressure and N95 are for airborne precautions. Question 11. To prevent aspiration during feeding, the nurse aide should: Option A, feed the client lying down. Option B, feed the client with their head tilted back. Option C, feed the client in an upright position. Option D, feed the client only pureed food. The correct answer is option C. Feed the client in an upright position. Upright positioning, Fowler's position, 45 to 90 degrees, allows gravity to help food move down and protects the airway from aspiration. Lying down or tilting the head back increases aspiration risk. Question 12. When measuring output, the nurse aide should record: Option A, urine only. Option B, urine, diarrhea, and vomitus. Option C, diarrhea only. Option D, vomitus only. The correct answer is option B, urine, diarrhea, and vomitus. Output includes all fluids leaving the body: urine, diarrhea, and vomitus. These are all measured and recorded to monitor fluid balance. Question 13. When a client with dementia is sundowning, becoming agitated at dusk, the nurse aide should: Option A, keep the environment bright and noisy. Option B, use a calm, gentle approach and low lighting. Option C, give the client a sleeping pill. Option D, ignore the agitation until it passes. The correct answer is option B. Use a calm, gentle approach and low lighting. Sundowning is managed with a calm environment, low lighting, quiet, and a gentle approach reduce agitation. Bright, noisy environments are overstimulating. Sleeping pills require an order and should not be the first response. Question 14. How should the nurse aide shave a client who takes blood thinners? Option A, with a straight razor. Option B, with an electric razor. Option C, with a safety razor. Option D, the same as any other client. The correct answer is option B, with an electric razor. Clients on blood thinners are at increased bleeding risk. An electric razor is safest because it reduces the risk of skin cuts. Straight and safety razors can cause nicks that bleed excessively. Question 15. When taking an axillary temperature, the nurse aide should leave the thermometer in place for: Option A, 3 to 5 minutes. Option B, 5 to 8 minutes. Option C, 8 to 10 minutes. Option D, 10 to 12 minutes. The correct answer is option C, 8 to 10 minutes. Axillary temperatures require 8 to 10 minutes to accurately reflect body temperature because the armpit is a peripheral site. 3 to 5 minutes is insufficient. For electronic thermometers, follow manufacturer instructions. Question 16. When making an occupied bed, the nurse aide should: Option A, roll the client side to side, working with one side at a time. Option B, have the client sit in a chair. Option C, make the bed with the client on one side only. Option D, ask the nurse to help. The correct answer is option A, roll the client side to side, working with one side at a time. Making an occupied bed involves rolling the client to one side while changing linens on the opposite side, then rolling to the other side. Having the client sit in a chair is for an unoccupied bed change. Question 17. The pulse site most commonly used for adults is the option A, brachial artery, option B, radial artery, option C, carotid artery, option D, femoral artery. The correct answer is option B, radial artery. The radial artery at the wrist is the most commonly used pulse site because it is easily accessible and does not disturb the patient significantly. The brachial is used for blood pressure and infants. The carotid is used in emergencies. The femoral is rarely used for routine assessments. Question 18. A client with depression refuses to get out of bed. The nurse aide should: option A, allow the client to stay in bed. Option B, gently encourage the client to get up. Option C, force the client to get up. Option D, call the family to get them up. The correct answer is option B, gently encourage the client to get up. Gentle encouragement with support and assistance can help the client participate in care. Allowing them to stay in bed may worsen depression. Forcing them is not appropriate. Family members should not be expected to manage care. Question 19. What should the nurse aide do if a client begins to choke during a meal? Option A, call for help. Option B, perform the Heimlich maneuver. Option C, pat the client on the back. Option D, give the client water. The correct answer is option B, perform the Heimlich maneuver. If a client is actively choking, unable to speak, cough, or breathe, perform the Heimlich maneuver immediately. Calling for help can be done simultaneously. Patting the back is not the recommended primary intervention. Giving water can worsen obstruction. Question 20. When performing passive RUM exercises, the nurse aide should: option A, have the client perform the movement independently. Option B, move the client's joint through its full range of motion. Option C, force the joint beyond its range. Option D, perform RUM exercises only once a week. The correct answer is option B, move the client's joint through its full range of motion. Passive RUM involves the nurse aide moving the client's joint through its full, pain-free range of motion. The client does not participate actively. Forcing beyond the range can cause injury. Question 21. A client is having a seizure. The nurse aide should: option A, put a spoon in the client's mouth. Option B, hold the client down to stop the seizure. Option C, clear the area and turn the client to their side. Option D, leave the client alone. The correct answer is option C, clear the area and turn the client to their side. During a seizure, clear the area, turn the client to their side to prevent aspiration, and protect the head. Putting anything in the mouth can cause injury. Holding the client down can cause fractures. Question 22. What is considered a normal blood pressure for an adult? Option A, 90/60 mmHg. Option B, 110/70 mmHg. Option C, 130/90 mmHg. Option D, 140/100 mmHg. The correct answer is option B, 110/70 mmHg. Normal blood pressure is less than 120/80 mmHg. 110/70 falls within the normal range. 90/60 is low, hypotension. 130/90 and 140/100 are elevated and indicate hypertension requiring medical attention. Question 23. Which of the following can cause an inaccurate pulse oximetry reading? Option A, nail polish. Option B, client holding their breath. Option C, client sleeping. Option D, client sitting up. The correct answer is option A, nail polish. Nail polish, artificial nails, and dark pigmentation can interfere with pulse oximetry light transmission, causing inaccurate readings. While breath holding and sleeping can affect readings, they don't cause device inaccuracy. Sitting up is a normal position that does not affect accuracy. Question 24. The apical pulse is located at the: option A, wrist. Option B, neck. Option C, apex of the heart, fifth intercostal space, midclavicular line. Option D, the elbow. The correct answer is option C, apex of the heart, fifth intercostal space, midclavicular line. The apical pulse is at the point of maximal impulse, PMI, the fifth intercostal space at the midclavicular line on the left chest. The wrist is radial, neck is carotid, elbow is brachial. The apical pulse is counted with a stethoscope. Question 25. Normal oral temperature range is: Option A, 96.0 to 97.5 degrees Fahrenheit. Option B, 97.6 to 99.6 degrees Fahrenheit. Option C, 98.6 to 100.6 degrees Fahrenheit. Option D, 99.6 to 101.6 degrees Fahrenheit. The correct answer is option B, 97.6 to 99.6 degrees Fahrenheit. Normal oral temperature ranges from 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit, average 98.6 degrees Fahrenheit. 96.0 to 97.5 degrees Fahrenheit is below normal, hypothermia. 98.6 to 100.6 degrees Fahrenheit includes normal and low-grade fever. 99.6 to 101.6 degrees Fahrenheit indicates fever requiring reporting.